Pain and movement are often viewed as opposites, but we need to really bring them together. Using tools like this, we can bring healing and motion together in the end, and that's one of the biggest things that we can achieve. Hello everyone, I'm Dr. Rob Vanbergen. Welcome back to our 10-minute training of the day. We're going to be talking about integrating microcurrent into an exercise routine for someone dealing with chronic pain. Now, if you've ever worked with clients who want to stay active but who are held back by pain, so fibromyalgia, arthritis, even just old injuries, this is going to be a game changer. So let's talk about how you can enhance recovery, reduce pain, and help your clients move more freely by blending this therapy into their fitness and rehab programs. So first off, a quick refresher for those of you who don't use microcurrent. What is microcurrent therapy? Microcurrent uses incredibly small electrical currents measured in microamps that mirror the body's own electrical signals. So unlike TENS units, microcurrent is subsensory. It's aiming to get into the tissue, and in some cases, it will work even if you're not feeling it. But the effects are profound. What this does is it increases ATP production. This is adenosine triphosphate, and it's the fuel source for our cells. It increases this by up to 500%, and that's been proven in studies dating way back into the early 1980s. It was way back, it was before I was born. More ATP means faster tissue repair, better circulation, and reduced inflammation. And that's what makes it a perfect partner for exercise in clients who are dealing with chronic pain, who often experience delayed recovery and tissue fatigue. So chronic pain notoriously makes movement hard, and for many of our clients, pain has robbed them of their mobility, which really can lose a lot of confidence for them as well. And they end up being caught in this horrible vicious cycle. Pain leads to inactivity, which leads to stiffness, more pain, and eventually it can even lead to disability. And the fear of flare-ups, inflammation, and post-workout soreness is very real here. Now, microcurrent therapy offers us a way to break that cycle because it's not just masking pain, it's modulating nerve function, it's reducing inflammation, it's activating the body's repair systems. And this is allowing clients to move with less resistance and recover more quickly. Think of it as kind of giving their body a helping hand so they can do what it's meant to do, right? Move, heal, thrive, live, right? Those are the things we're meant to be doing. So how are physiotherapists using this? Because it is being used in physiotherapy. In clinical settings, it's used before, during, and after treatment sessions as well. When it's used before movement, it's working to reduce guarding and pain sensitivity, which is perfect for warming up the body and improving range of motion. So any kind of anti-inflammatory treatment here is going to help to kind of get that movement going, get some minor blood flow in there, get some more ATP production, and make it so that the person has a little bit more flexibility. It's also used during therapy. So in some cases, it can be combined with stretching or myofascial release to relax stubborn muscles and improve engagement. And afterwards, it can be applied to reduce inflammation, to improve lymphatic drainage, and ultimately to speed up muscle recovery. Now, you could use it in any and all situations, but most of the time people tend to pick one where they want to focus the microcurrent on and then use the manual treatment after. For example, a physio might apply microcurrent to the lower back before doing core work with a patient. And then, they could opt to follow up post-session with the treatment to prevent soreness or spasms. Conditions like frozen shoulders, sciatica, fibromyalgia, these respond incredibly well to this sort of combo approach. And honestly, clinical trials and countless case studies have documented not just pain relief, but increased function and reduced inflammation markers. So all things that are signs of the body working better. So how do fitness professionals use it? I think in the fitness space, it's used pretty effectively too, though it's lesser known because it is kind of costly to get started with it. But whether you're in the fitness space yourself or your clients are, you can be using this across all forms of this kind of space. Pre-workout, starting with 5 to 10 minutes of application on key pain zones, so knees, shoulders, lower back. This can reduce stiffness and prep the muscles. I've had athletes before that have used blue stimulation on these areas prior to going in to a game, and this has been able to enable them to increase that ATP production. Now, you could use these during the workout. Some of our microcurrent tools allow you to essentially use the sticky pads as wearable microcurrent patches. This can be done, especially with the exercise programs in the Pinnacle device, to kind of modify strength or enhance the mobility exercises. And we've seen clients go from barely tolerating movements to finishing a full routine without flaring up at all. And post-workout as well, you can apply microcurrent for 10 to 15 minutes on major muscle groups, and this reduces the risk of soreness and it improves tissue recovery overnight. In fact, one client we had with osteoarthritis in both knees uses this approach. Pre-treatment, we use microcurrent to reduce her discomfort. Then she performs seated resistance band walk and water walking. And post-session, another round of microcurrent on her quads and knees. This helps her stay pain-free for days. It's gentle, it's adaptable, and it empowers people to move without that fear. Now, what you should do in order to do these treatments is, when you're looking at this, is to always do it based on the individual patient. We want to use electrodes symmetrically across joints or along pain pathways as well. We always try to isolate these groups. I also find pairing microcurrent with breath work is really useful as well, especially for activating the parasympathetic response, but also for improving range of motion. When you take in a deep breath, you expand your body, and then when you exhale, your body relaxes in a different way, and it can really open up and improve movement. I think it's important to monitor and log how clients respond to each session. And for anyone that's inexperienced with this, I would highly recommend starting really small. Start with the before exercise treatment just to see how they work for the client and work through these different situations. Now, you could also send your client home with home use microcurrent that they could use daily to improve their situation too and maintain those results between sessions. And in most cases, this is going to be very, very beneficial, and of course opens up another revenue stream for you as a practitioner as well. Ultimately, microcurrent is a very flexible tool, and this is what I really wanted to take away from this, is that whatever discipline we're in, there's a space and a place for microcurrent therapy. It's safe, it's natural, it's scientifically supported to improve outcomes for clients with chronic pain. And it accelerates recovery, it improves mobility, and it does, of course, reduce that pain, making all of these things easier. I think it can be integrated into everything we do in practice. Our warm-ups for people for their exercises, if they're going to do workout sessions, even the cool down period afterwards. Whether it's in the clinic, whether you're working in a gym, whether it's at home care, there's something to be said for the power of being able to reduce that pain, to improve that circulation and get that extra energy into the cells. I think pain and movement are often viewed as opposites, but we need to really bring them together. Using tools like this, we can bring healing and motion together in the end, and that's one of the biggest things that we can achieve. So thank you for joining me today. If you want to explore this more, definitely check out our YouTube channel. There's plenty of information on there from both the fitness and the microcurrent perspective. And as always, if you have questions, drop them in the comments below. I'm Dr. Rob Vanbergen, and I'm here to help you and others live pain-free. That's what we want to achieve, and that's what we're doing with your support. Thanks, everyone. Take care. Bye-bye.